Are you a medico or are you aspiring to become one? If the answer is yes, then this vlog will take you to a place where you see yourself in the future and gives you the complete feels of becoming a doctor. If yes, then subscribe to this channel and comment yes in the comment section. Good morning, potatoes. It's somewhere around 7:30. I decided to film myself today, so let's go. This vlog is going to be so interesting for you all because I'll be taking you guys to my posting, and my posting is in emergency medicine. So you guys are gonna have a very different experience of how it feels to be in the casualty and emergency arena. So yeah, do watch the video to the end, and I am just gonna go walk out a bit.
2,000 years later.
I started off by doing 5 minutes meditation with music on, then I did a full body stretch because whenever I feel lazy, full body stretch helps me a lot.
I've been paranoid, you're like a Polaroid.
So since it's going to be a clinical day at the hospital, I need to revise a lot of my basics like how to interpret an X-ray and the CT scan and MRI. For that, I am watching Dr. Nikita ma'am's lecture. I am totally in love with her teaching style because the way she teaches, firstly she'll clear off your all the basics and then gradually she'll just level up. It is so student friendly. So if you are planning to study radiology, then she is the best mentor you can have. Guys, अब lecture तो खत्म हो गया है, but now it's time to solve some questions. Shit, I got this one wrong. Oh my god, I'm scared because this is the first time I'm studying radiology. I'm gonna tell you guys a strategy that I usually do while solving the question bank. Since I got this question wrong, I will go in depth of this question. Then I will analyze my thought process as in what I was thinking while solving the question, so that next time whenever the same question comes, I do not repeat my mistakes. This app has got prep vocab inbuilt app dictionary. Okay, whenever I have got confusion somewhere like this underlined word hamartoma, it just gives me the definition of that so that now I don't have to go back to the textbook again. Also giving a look at the learning objectives because that just summarizes the whole topic. I feel this question is so important that I'm gonna bookmark it so that I can revise it again. Also, it's mentioned at the top whether the question is one-liner or clinical, so I got this clinical question correct. Solving questions from the question bank just helps you both for your NEET PG as well as for your prof exams. Then I have this paneer stuffed sandwich and raspberries for the breakfast. After breakfast, it's time to get ready. It's around 9:30 and I'm quickly gonna take shower and get ready for the post. So today I'm wearing this white kurti which I got from W with black plazo, and first thing first, wearing the coat, and it's done. Let me just brief you guys what's फोर्थ ईयर इज ऑल अबाउट. सो अभी फोर्थ ईयर की क्लासेस शुरू नहीं हुई है. होता क्या है, फोर्थ ईयर स्टार्ट होने के थोड़ा सा पहले लाइक जस्ट 1 month बिफोर वी गेट क्लिनिकल एक्सपोजर एज वेल एज अ लिटिल बिट ऑफ नॉन क्लिनिकल एक्सपोजर, यू नो, जस्ट टू रिवाइज एवरीथिंग. सो 15 days की हमारी नॉन क्लिनिकल की इलेक्टिव थी, दैट हैज ऑलरेडी बीन डन, एंड 15 days की अभी चल रही है, दैट इज क्लिनिकल इलेक्टिव. सो वी गेट अ लॉट ऑफ ऑप्शंस लाइक इमरजेंसी मेडिसिन, एंडोक्राइन सर्जरी, जनरल सर्जरी, मेडिसिन, अ लॉट ऑफ ऑप्शंस लाइक दीज, एंड वी हैव टू चूज वन इलेक्टिव ऑफ आवर चॉइस, just to explore that field a bit more. So I have chosen emergency medicine because I am more of a adrenaline rush wala person. So yes, I like working in casualty and in the trauma center and in emergency medicine. And today I'm gonna take you guys along with me. Okay, so let's go. So this is emergency critical care medicine. एंड यहाँ पे बहुत भीड़ होती है गाइस बिकॉज लगातार कोई ना कोई पेशेंट आता रहता है. सो एंड इमरजेंसी मेडिसिन में सारे ही इमरजेंसी केसेस आते हैं एज द नेम सजेस्ट. सो आई एम इन SHA ward राइट नाउ. आई एम वेयरिंग माई ग्लव्स. ओके, दिस इज नॉट द करेक्ट वे टू वेयर ग्लव्स बिकॉज हमें स्टेराइल कंडीशंस मेंटेन करनी होती हैं. आई विल शो यू फर्दर इन द वीडियो हाउ टू वेयर ग्लव्स प्रॉपर्ली. Okay, I'm not holding up the camera because there are a lot of patients and everybody is under emergency conditions, so definitely I just cannot put on the camera. Okay, here our senior doctor are teaching us how to interpret the X-ray in practical, and this is the CT scan of head. Okay, my friend Abhay has just come and he is gonna teach you guys how to wear proper gloves.
मतलब जैसे कि रखा हुआ है तो मैं बोली कि इधर से स्ट्राइल होता है, इधर से पिक करना होता है, ठीक है.
So this is how we do it. Now I'm gonna go to several patients. I'll take the history and try to interpret CT scan and X-ray on my own. After doing this, we all went to the patient जिसमें हमें Ryle's tube डालनी थी. Ryle's tube is a tube that is meant for artificial nutrition. Here we are auscultating कि जो Ryle's tube है वो सही जगह पे गई है कि नहीं, कहीं गलती से ट्रैकिया में तो नहीं चली गई. Okay, now apart from this, we also saw how to intubate the patient. Also, our senior doctor taught us how to check the ABG. ABG is basically acid base analysis test, which is so important कि कोई भी patient emergency में आता है, so the first test we do is ABG only. But how to interpret it real quick is what is being taught to us right now. After getting to know a lot about ABG, we were also taught about elevation tube, like all the parts, everything about it. Then I checked few more x-rays, how do they look and what's the pathology in them. So this is basically pleural effusion, and in the same patient we saw how to insert the intercostal drainage tube. It's 1:30 p.m. right now and I'm back to my hostel. Abhi I'm in mess. Gonna have lunch. I literally wash my hands so well because they might get infected. So अभी मैं गाजर और आलू की सब्जी खा रही हूँ. This is dal and roti.
2,000 years later.
Guys, I'm back to my room and let me just tell you everything that we did there. But today the day was so overwhelming, it was so busy. I did a lot of procedures and learned a lot of things. Okay, that was really a lot for today. Not just these, I also saw something really weird today. There was a patient sitting normally and suddenly she puked and the vomitus contained pure blood. Like pure blood. Nothing, like no contents out of gut. The food, it was not the normal vomiting, it was like the pure bloody vomiting. And yes, that was kind of very traumatic and thoda sa ajeeb sa to watch that. Then there was a case of hanging, and guys, the patient had just come. He was on his deathbed, of course, because वो रास्ते में I guess उसकी death हो गई थी, and then he was there in the emergency room. And uske relatives, they started crying. They asked for a confirmation. So uske liye the doctors did an ECG. ECG showed in straight line ECG, and oh my god, that was so I just don't know what the word that I can say. There was a lot of chaos. Okay, it was a day full of experiences. So yeah, that was it. It's somewhere around 1:30 right now, and I have again got a class of emergency medicine from 3 o'clock. Okay, so meanwhile I'm just going to edit the same video that you're watching right now, and most probably I'm just gonna upload it today itself. Let's go. I'm gonna be editing the video and you do something productive. Okay. क्या नहीं लिखा?
चेक कर ले तो फिर
So from 3 o'clock, we got a lecture of emergency medicine itself. It's a part of our elective where we were taught hypocalcemia and hypercalcemia, and I made huge notes. And not just this, we were also taught about how to resuscitate a patient if there's a sudden heart failure. After such a tiring day, I made plan with my school wale friends to go out on a long drive. I really wanted to eat something so good, and this is what I ordered. This is the veg platter, which is like 56 bhog lag raha hai ye to dekhne mein. And also I ordered smoky grilled tandoori chicken. Okay, say hi to Elisha and Bhavleen. Those are my bestest friends from school. And yes, I think that's it for the vlog. Don't forget to hit the subscribe button before leaving, and bye bye.